Brand new webinar with Rejuviwell. We're here to announce a brand new treatment called UltraClear. This is our virtual launch event with Kate Reed. If you have any interest in laser treatments or in skin rejuvenation, we're going to explain what this laser is all about, what it can be used for, and why you might consider it over other treatments. We're so excited for this new device. We also have a promotion and a special surprise today, so please make sure to stay tuned until the end of the webinar and we'll announce how that works. Before we get started, please let me introduce our wonderful speaker. Kate Reed is a board certified full practice authority nurse practitioner specializing in medical aesthetics and hormone optimization. She is known for her personalized whole body approach and commitment to the safest, most advanced techniques. Not only does Kate own Rejuviwell, but she is a clinical director, mentor, and educator dedicated to elevating standards in the aesthetics community. So with that, we'll pass it to you, Kate.
Hi, guys. Hi, everyone. I can't see you, but I am so excited that you're all here. And I cannot wait to share with you the hottest new treatment in my practice, which is the UltraClear device. It is a amazing laser that pretty much does everything. So I am going to get started. So, one of the first questions everyone asks me is, are you a candidate for UltraClear? And pretty much everyone is a candidate. This is the safest, most advanced technology out there. The reason I chose this laser, you guys know I love to do all of my reading and research and have been blown away by this device, is because it really is for everyone. I have the ability to treat all skin tones, all textures, fine lines, wrinkles, acne, surgical scars, burn scars, pigment. It's really an all-in-one device, and the technology is so pretty much futuristic that it's so customizable that I can treat pretty much anything, and those treatments can vary, but that's something we'll get into in a little bit later. Why do you choose the UltraClear over some of the other things that are out there? You may have never even heard of UltraClear. Many people have not. That is because it's new and it's not in a lot of hands. And I am very lucky to be one that has it. So this laser works very differently than a lot of other lasers, and it has a proprietary patented what's called cool pulse technology. So unlike other lasers that have a lot of heat, ablation, coagulation, this does not have that excessive heat needed to get the results. So you get significantly less downtime, less pain, and it really is an all-in-one solution. It is quick. It's a very quick treatment. The numbing takes longer than the actual procedure, and not everyone needs to be numbed. It depends on what kind of treatment we're doing. And there are a million different ways that we could customize this. We can do multiple areas: face, neck, hands, chest, scars, anywhere you have scars, burns, laxity of skin. So it really is an all-in-one amazing piece of equipment. So this is just a little slide here. When I talk about all skin types, it is the most inclusive laser, which is why I chose it. Many people over a FITS type 3 cannot do a lot of traditional lasers because of the amount of melanin in their skin. So I have the ability to customize this to be safe for all skin types. So even deeply pigmented or darker skin, is safe. We can't do all the treatments on all the different skin types. However, it is safe, and there is a treatment available for every skin type. So when I say UltraClear, that is the name of the device behind me, but it actually is many devices in one. And there are three specific kind of levels of treatment. So the 3D Miracle, which we will get into, and which you guys, if you sign up, will be able to experience yourself, just does that superficial layer, that stratum corneum. You do not need to be numbed for this. There's minimal downtime, and it really is just getting that natural exfoliation and the rejuvenation of that top layer. Um, we are then able to customize it into different modes to go deeper, going down into the epidermis and the dermis, and then our most advanced treatment, which is referred to as laser coring, can get down into that deepest layer, where a lot of that collagen remodeling comes from, which leads to, when tighter skin from the remodeling of the collagen over time. That is not an immediate result, but that is possible. So this is offering something, you know, a lot of you will have asked me, is it like an IPL? Well, that's just a surface level versus a CO2, which is very ablative down to the lower, deeper levels. So we can do all of the things. It's just how we customize it and what modes we choose to use. So this is a nice slide that will kind of show you guys all the levels of treatment. And when you have a treatment, you may have all three in one treatment, meaning we do one area of laser coring, to, along the jaw or maybe in the nasolabial folds. And then we do a little bit of clear or ultra clear on a scar and then some superficial. I always, no matter what treatment is, even with the more intensive treatments, even if we're not doing the whole face in those modes, you will always get kind of an all-in-one superficial laser as a topper for that treatment so that you at least have exfoliation in all areas of the skin, especially the face. The concerns that we really want to treat, like superficial lasers like Moxie, an IPL, those are really for your skin health, your skin glow, your tone, texture, pore size. It does help with sun damage and pigment. Whereas when we're really looking at aging or acne or deep scarring, we need to get a little deeper than that stratum corneum. So those modes are kind of the ultra clear, clear plus, ultra clear. And those are what we wanted to use for fine lines, wrinkles. You're going to have a little bit more downtime with that, but it's going to be a process that still is much less than any of the traditional lasers that have been out there. The more advanced modes, these are going to be your more downtime. This is going to be, you really need to have 3 to 5 days where you don't want to see people. You might be swollen. You're going to have oozing, maybe some bleeding. But those really get down into that deep layer and is going to give you those really dramatic results. So why did I choose UltraClear? So I am like a science nerd, and if you're on this webinar, you know me and you know exactly what I'm like. But I love to learn all about the things and have the best that's out there. So this is really the first like new technology that has come out since the 90s. A lot of people, you guys have asked me, about CO2. That's a very ablative laser resurfacing. You know about the YAG, and those are now branded in many different ways. Every laser really works in those non-ablative YAG CO2 realms. And in 2007, the laser was invented by an amazing, smart engineer who actually developed all those old lasers. And he wanted to find something that could really change the way we use lasers and the comfort and the downtime for the patients. So he found the laser and in a lab, and he worked with it and developed something amazing and customizable. And really, a lot of machines that people have sitting in their offices are now obsolete because this can do a lot of the things of those devices. The company was founded in 2018, got FDA clearance in 2021, and then it was launched in 2022. So it's not in a ton of practices because it's fairly new, because it is such an advanced technology. And it's really seen mostly in oculoplastics, plastics, derms offices. And I am very fortunate to have it in mine because I only want the absolute best for my patients. They actually just got some more FDA clearance for vascular dyschromia, and also pigmented lesions. So it really can do everything. So how does it work? So when I say this has less discomfort during treatment and decreased downtime, it's because of this technology. So I'm going to play this video for all my science nerds out there, but this is what's their branded 3D IntelliPulse. And what that is when you have a laser going through your skin, generally there's just burning down. So you're ablating that layer with heat. And that can lead to some people to have bleeding or what's called post-inflammatory hyperpigmentation. You know, if you have melasma, this can sometimes, if you just do all heat, that can actually aggravate it versus this laser, that's not an issue because as you can see, those little red arrows, that's the heat, but mixed into that heat, there's also basically cold fiber. So this laser, unlike other lasers, is made of fiber, like fiber optics, like that's in our cable. And so it's able to do this change in thermal impact that you cannot get with the other more traditional heat only lasers. So because of that, it can result in multi-level collagen remodeling with less discomfort, less downtime. The 3D Miracle, you don't even need numbing. It doesn't hurt, and it gives the same result as many other things on the market. So, what is a treatment like? It depends on the treatment, but once again, that's something that has to be customized to what your concerns are and what you guys want. The 3D Miracle is performed with this UltraClear device, but you will hear me refer to the 3D Miracle because that's just the superficial layer and it's just causing that natural exfoliation, versus the other treatments are going deeper. So I'm just going to play you a little video here.
But you say you're 23?
Yes.
Okay, my daughter's going to be 26 in February. I do.
So you guys know that voice, that was Mary. But you didn't need our talking. We were chatting, obviously, but you can see it's a very quick little pulse there with the laser, and we just go across. She's getting a 3D Miracle, no numbing, and we're chatting about kids. So I'm going to now go into the different types of treatments and just give you a lot of kind of before and afters and some examples. All of my patients that I've seen in my practice that are in here, just to note, all of them are just post one treatment and not yet far out. So some are about a month out now, and some of the treatments you need months to see collagen remodeling. Think about cell turnover, it takes time. So with the UltraClear, with this 3D Miracle, that's the superficial layer, you're going to see faster those results that you're looking for because we're looking for the decreased pore size, the pigmentation changes. So this is me. And you can see here, and anybody that's seen me recently and has been like, wow, your skin looks like great, despite my hormonal acne that's happening at the moment. But that's my own doing from my hormones. But you can see I've always had, some pigmentation changes here, especially during pregnancy. I kind of got that mask, and I haven't been pregnant in 13 years and it's still there. I've done other lasers, and I've had some results, but nothing that was this comfortable with like very little healing to get such a dramatic result. So you can see I have some pigmentation. And the other one, unfortunately, I took a very bad before picture with my lighting, but it's much better in the after picture because I'm still learning. I am not a good photographer. I'll leave that to my husband. But you can definitely just see the overall appearance of the skin is just greatly improved in my face, just from one 3D Miracle. This is a much better photo from a dermatologist, but you can see this woman has some hyperpigmentation on her cheeks. Even some of the fine lines and wrinkles are much improved, and that's just 1 month after one treatment with a 3D Miracle. These are a couple of my other patients who are just to show you, what to expect. So the 3D Miracle is quick. It takes 10 to 15 minutes, doesn't hurt. Downtime, I mean, I went right to Target, but you may look like you have a little sunburn. And then in the next couple of days, you will have a little bit of peeling. These patients here were all treated with the same 3D Miracle. And you can see my face, I have, a pretty red area here, like a sunburn. That was gone by the evening, but some of my other patients were barely red at all in that area. So it just depends on your skin and how you react. Some people will be really red and feel warm. Some people won't really notice much at all. This is my lovely patient Kate here, who you can see right after her 3D Miracle. You can actually see kind of a couple of those white lines. That's where the skin was not ablated. But this after picture, I mean, her skin is glowing. Her pores were drastically changed. I mean, she just has a nice glow. This is like what you want to do a couple weeks before an event because you want to get a nice glow. So, this is another example of a younger patient who had some pigment changes and just overall dull skin, and you can see how her skin is nice and glowy. This is another photo of right after the 3D Miracle, just to, you can see where there's a little bit of redness there in her skin. Here's another example. So this is this patient. This was her before, and you can see her after, and you can see a great improvement in those fine lines right around her mouth and under her eye. And this was just with the 3D Miracle treatment. We did not do anything deeper than the top surface layer. Here's a person with a skin of color. I just wanted to show this is completely safe on all skin types, colors. And here, just that dullness in her cheek area and just the overall appearance of her skin. And you can see 1 month after, she did have a series of 3 treatments, and that's what is recommended. I always recommend 3 treatments, 4 to 6 weeks apart, to really get all that cell turnover and all of that new skin. But some people can just do 1 if they're looking for just, depending on what your age and your skin type, but I recommend a series of 3 for the best results. The neck, everyone wants something with their neck. And you can see this patient here just had a 3D Miracle on her neck, and that's a vast improvement, especially on aging skin. A lot of times we have to do a little bit deeper treatment, but we can do just the 3D Miracle and still get great results. I wanted to show this patient because this is some severe pigmentation there. And this was a little bit more than 3D Miracle. It's called the clear mode, but it's not much more ablative or downtime. And you can see the vast improvement in that pigmented lesion. Here's another patient with some hyperpigmentation. And you can see not only the skin color looks better, or the skin tone looks better, but also it's brighter and a lot of that pigmentation has gone away. Hands are a huge thing. Our hands are in our car. We don't put sunscreen on our hands when we're put sunscreen on our face, which I hope everyone wears sunscreen every single day. Even those of us that work in the hospital all day, you need sunscreen because you need to block out the free radicals in the air, the blue light from our computers. It's important for overall skin health, but we don't put it on our hands. So a lot of us age a lot in our hands. And so this can take a little bit longer, a couple more treatments to get rid of those sunspots, but you can see these great results on a more mature hand, should we say. Here's another great example of a pigmented lesion that this patient has there on her cheek, and also just the overall acne scarring. I'm not sure if you can see that, but this clear mode, which is a little bit deeper than the 3D Miracle, but once again, this is 1 treatment that this patient had, and this is 5 days later. So she is glowing, and she already has a vast improvement from that 1 treatment. So everyone's results will be different, but it is something that some people will have amazing results with just 1. So I'm going to go now into kind of our moderate treatments. These are the UltraClear or the clear modes, and these are a little deeper. So this is everyone's, what can I do here? I get asked this question by 90% of my patients, myself included. And these lines under the eye are just so hard to treat, especially with neuromodulators. You don't want to put filler under your eye. Even PRP or growth factors can help, but it's really a hard area to treat. And this laser does amazing around the eye. It's actually being used by a lot of oculoplastics. For almost like a non-surgical bleph, which is how I learned about it when I had a visit with an oculoplastic over the summer. That's kind of where this all started. So you can just see here just the improvement of those fine lines and wrinkles under here, which we all know if we have them, the concealer gets stuck and we hate it and we want it to go away. So this is a great treatment for that. Scarring, this, I will say, when I was looking into purchasing a laser, I was looking for something that could do everything. And I like to take care of everyone all the time, maybe at a fault. But scars are hard. And I have scars of my own that I've wanted to have lasered for years. And usually when we have deep scarring like this, we have to do something like a CO2. CO2 laser is very painful, and especially for scar patients. So it and takes multiple treatments. You can see here, this is a very, distinct scar, and just one treatment, you can already see that regeneration of skin. And it's really amazing. So I think I have the other patient I'm going to tell you about, but this is a customized treatment, meaning we have done probably some UltraClear and maybe even a little bit of laser coring around the mouth. But the pigmentation change in this patient is amazing, especially because as we age and that's there longer, sometimes that can be really hard to get rid of. And you can use every cream and medication on the market, and it's not going to go away until you actually get that skin to rejuvenate and remodel. So this woman had amazing results, not only with the pigmentation, but even in the jawline. You can see right here, some of that jowling just is markedly improved. The reason this picture is 2 months later is because it takes time for collagen remodeling to happen and for that tightening to happen. And if you come back in a month, you're going to see change in the pigmentation possibly, but you're not going to necessarily see change in the actual tightening of the skin or laxity of the skin. And you can see it in this patient 2 months after one treatment. Here's another example of around the eyes. This is a really amazing result for those deep lines. And this patient only had one treatment with an UltraClear mode, did not have any other treatments, no fillers, nothing like that. And even you can see on the cheeks just how much better his overall skin health is. This woman, acne scarring, I am, yes, older, but I am on hormone replacement therapy, and I will sometimes now get hormonal acne, which is worth feeling great, but it's a pain in the butt. And if you're a picker, that could become a problem. And so this is a great device for that, those hormone, like any kind of acne scarring, especially in this patient. You can see she not only has some scarring, but she has a lot of inflammatory active acne, cystic acne too as well, and this can help with that. Here is another more mature patient, and you can also just see the change in the skin texture. The fine lines and wrinkles, especially around her mouth, are just markedly improved. Don't worry, I'm not going to show you pictures for an hour, but I think it's important to look at all of these examples just to see the different skin types, ages, and what can be done. This patient here, once again, you can see the pigmentation change and just the overall improvement of the jawline, around the mouth, and especially that pigment on the forehead and under the eyes. This is cystic acne. This is years worth of acne. A patient like this, you're on Accutane for years, but you still have those that long-lasting effect of the cystic acne. This is one treatment with the UltraClear mode, and you can just see how amazing the scars have gotten. Another amazing neck result. I have a lot of people ask me about necks, especially as we get in our fourth and fifth decade of life, or if we're losing weight and we have a lot of laxity. This is where we see it. We got the little gobbler sometimes. This is amazing for that because it's able to do that tightening without getting a neck lift. I can't say it replaces it, but it's able to do enough to help with that laxity there. Another cystic acne patient just 1 month after one treatment with traditional lasers that everyone has. These are multiple treatments to get these type of results, and those are painful. This treatment is not painful. Yes, you will feel heat. You might feel swelling, some discomfort after a more ablative treatment, but the treatment itself is comfortable. The aftercare is easy, and you're getting amazing results with much less downtime and much less discomfort. Here you can see a series of treatments with this patient. And oh my gosh, I'm sorry, I just went on the wrong slide. But this is amazing. These results, as we get older, it's really hard to get results like this without a surgical intervention. And we have, you know, lasers have been really popular and becoming more and more popular for a good reason. But now we have the technology to say you may never actually need that, surgical treatment for much longer down the road. So this is a great result to show what you can, see with the UltraClear mode. This little guy here, we can do pediatric scars, and it's very, very comfortable. This patient, the physician actually said, this patient loved coming for his laser because he would pick the size of and the shape of the laser. So I can fully customize this laser to be in a circle, a square, a rectangle. And so that was something that this little boy loved when I talked to the provider. And you can see just the vast improvement in that scar. It's a very deep scar, and just what great results we have. This patient also, one treatment, look at that change in her pigmentation. It's just amazing. You can also see some changes in the laxity, and this patient as well, who you all have seen a million times because it's on all my flyers I've been putting everywhere, but these are amazing results for one treatment. Not everyone's going to have the same results for one treatment, but this is what can be possible after one treatment in the UltraClear mode, which is more of like a moderate treatment level. Same here. This patient did have a series of 3, but look at how much wrinkling, fine lines, pigmentation. I mean, years of probably being in the sun. She's a redhead. So, that stays. And this is 3 treatments with UltraClear, and that's just amazing. So, before I get into this, I just wanted to quickly talk. So, the UltraClear is still very comfortable, and you're not going to see, significant bleeding or significant swelling, but it's going to get amazing results. We have something called laser coring, which is basically the deepest on that first slide that I had showed you. And this gets down to that dermis and really does its work to be like a CO2, without being a CO2. CO2s, that's like basically we want to burn a whole face off. I almost did one a week before I learned about this laser. Thank goodness I didn't. But it is, we're getting all that skin to rejuvenate and remodel. And this is what people really need, especially if they have that laxity here, really deep around lines around here. We can do it on the eyelids for like a non-surgical type of bleph. So that's going deep. So I'm going to show you the difference between when we looked at the first kind of microchannel pulses versus the laser coring, and everything we can, even in the different modes, I can customize it based on where I am on the face or the body, based on the depth of the skin, how, much laxity there is. So this is just kind of showing you how it's, you know, making that little flower pattern. Um, and when you have the laser coring, you will actually see just these little holes, and those can stay for a while. They're not going to be dark and noticeable. They cover them up with makeup, but it's because we're going all the way down into that dermis to really get that regeneration of the skin. So this is the most ablative. This is the most, linked close to surgical mode. And it is where you have the most amount of holes in your skin. So you have to really be cautious to, keep it clean. And there's a lot more healing involved. So I actually did a patient this morning, and we did a combination customized treatment. But I'm going to show you me doing the actual laser coring of the jawline so you can see what that looks like. You might be able to see just the little pinpoints. It looks like I just took a toothpick and kind of went along her jaw. She is completely comfortable chatting, not right there. I asked her not to talk so I could take the video, but very comfortable. Even with numbing with a CO2, it's not comfortable at all. So this is superior to the CO2, and the comfort level is much better. This is my beautiful patient, and her concerns were, jawline around here, and she also had a lot of sunspots. She's had a couple taken off in the past. So we did laser coring around the jawline, and then those dark patches that you see, especially the 2 days post, those are where we hit pigmentation spots with more ablative to get down deep. So that's why you're seeing those dark marks there and on her nose. But you can see even 6 days. I mean, she has makeup on and can go to a party. And even with, having those marks, they're not going to be dark anymore. But that's amazing. 6 days. I mean, for a CO2, you can be out for 2 weeks before you can want to leave the house. So we didn't laser core her whole face. That's really intense. But just in these areas, we did around the nasolabial folds, you're going to just see that the healing is amazing. Now, she's not going to see the effects of that collagen remodeling for 1 to 2 months. Just like with biostimulator patients, I always say, it doesn't come overnight. You have to wait because your body cell turnover doesn't happen overnight. So it takes time for that skin. When you start a new skincare treatment, you got to do it for 3 months. Why? Because it takes 12 weeks for that cell turnover. So you just have to kind of wait for those longer results. But even just seeing how well she healed from this is, and I can't wait to get her 1 month, 2 month post. Here's another patient. She wanted to go hard and all the ablation, and you can see the squares on her face 1 day post laser coring. So she had laser coring in areas along the jawline, nasolabial folds, and then we did another clear mode on top. And so each mode kind of has a different pattern in the skin, but even just the overall appearance, the true collagen remodeling hasn't taken place, but the skin tightening. But just 1 week later, I mean, she's back to, doing things. I mean, she was back. Some people don't care. Like, I went out with my face with all the marks. Some people want to not. The only thing is, if you go out, you have to be diligent about keeping it out of the sun, because not just sunscreen, but like a hat, like hide it. So this is a great time of year to do all these things, because until today, we hadn't had sun in 10 days. You still need your sunscreen, but it's not as high of a risk factor. So here is a patient, and you can just see all of the changes in this patient. This patient's thin. She's a little more mature, which means we're losing that fat pad. We're getting saggy, and she has a lot of pigmented changes, and then also a lot of aging changes around the mouth, perioral area, the eyes. This is one treatment, and that's really amazing. Um, Here is another patient. I mean, just look at the change in the skin laxity on this patient. This picture is 5 months later. That's because it takes time for that skin to heat to change over. Skin health is important too. Your results are going to be better if you take care of your skin. Do you drink water? Do you wear your sunscreen every day? Do you use your skincare routine? All of those are going to be factors in this. Do you drink a lot? Do you smoke? Do you do things that aren't great for your skin? Those are also going to affect your results. And here's another, here's the patient again, a side, different angle. But once again, even 6 weeks later, I mean, it's amazing to me to get these results with just a laser, to be quite honest. This is not surgical and so much less downtime. And then look at the change in the perioral rhytids on this patient. It's amazing. You know, Historically, a lot of times with these patients, I go in with a filler or a biostimulator and I do some subcision of all those, and you're still not going to get results like that with this one treatment. And then here's just another view of her. One treatment. Like, that's amazing. And that is only going to be better because that's only 6 weeks out. This picture I put in there just because I wanted to show, this patient in her periocular area and just the improvement in that overall area. So that is all I have from my end of the presentation, but I want to just tell you, um, you know, this is something I'm so excited about, and I want you to share with everyone, and I want you guys to all experience it. So this is a link to fill out a form for booking, but you will receive 10% off of your customized treatment, depending on what that is. You have to have a consultation so that we know, but you will get a free 3D Miracle, which is a $600 value, and I will waive the consult fee on that. So just so you know, if someone asks you, how much do all these things cost? I do charge a consultation fee for my time, but that can always be used towards your treatment. It's just to be a priority of my time with that I can give you. And you guys know I spend way more time. Half the time might not be talking about your skin, but that's why you love me. So, but you will have no consultation fee. So if you want to take advantage of this, scan the QR code and then you can go to my booking site, and I have waived the deposit fee for the 3D Miracles. So I need you to get on the books.
Yes. Thank you, Kate. This was amazing. I hope you all learned a lot. Please go ahead and enter any questions. We do have a couple in here now, so I'm just going to fire away, Kate, if you're ready.
Of course.
All right. What makes UltraClear different than other fractional devices like a CO2 or Fraxel?
So it's really their proprietary technology and the fact that it's cold fiber. So I know I mentioned earlier, what the hell is cold fiber? So what that means is this is the machine here. This is my baby, and it has been developed with fiber optic cables. So because it has that fiber optics, it's able to deliver the ablation of the skin without as much heat and damage, essentially, because it's having those pulses of heat and cold. So a CO2 is just ablative, which is why you can't use it on everyone, because you're going to get a lot more post-inflammatory hyperpigmentation. And the way that traditional lasers work is they're attracted to the water and the blood in the skin. So you can't do darker skin types. You get a lot of bleeding. You can still have bleeding with the laser coring of this because we're getting deep in there, but it's nothing compared to what you would see with the CO2. And I think this is superior, to be honest. And actually, the person that developed a CO2 is now he is now UltraClear. So I think he knows he made something better. So I'm gonna, that's why I went with this. But absolutely say, I don't want to say same results. The results are most of the time better,
Yeah.
and you have so much less downtime. I mean, even for a CO2, even if you didn't do your whole face, like you're not going anywhere for days, you're not leaving the house. You could technically still go out. You just have to protect your face after, one of these ablative lasers if you're not too swollen or things like that. But it's really the downtime, the change in downtime and just duration of healing is just, it's superior.
Awesome. Thank you so much. Um,
Mhm.
Another question here. How do you decide which modes to use?
So how I decide the mode is really customized to every single patient. So everyone can do a 3D miracle. Anyone and everyone can do a 3D miracle. It's safe for everyone. And it will still address those surface level things. Think of it like your lunchtime peel. It's 15 minutes, you're in and out, you have exfoliation, you may have a little bit of peeling, but like 3 days later, I mean, you could go to wear makeup the next day, but in a few days, you're kind of done. But in terms of each patient, we have to look at what are your skin concerns? What is your skin type? What is your age? How long have you had those issues? I mean, if you're 70 years old, you've been working on those wrinkles and sun damage for a long time. That's going to need something more aggressive, likely, than my 27-year-old patient that has a little bit of acne scarring. So really you need to sit down with me. We need to talk about what you want. That everything I do is based on what your concerns are and what will make you more confident. So we talk about what it is you're looking for, what results you're looking for, and then we come up with a treatment plan. And that's how we decide what modes, because each mode works a little differently. And it's really like a cocktail of things. We don't always use the same mode on the whole face. So, like the patient I showed in that video, we did laser coring on the jaw and down the neck. But then we just did some clear mode here, and then some ultra clear. So it's just really depending on what we're attacking and what we're trying to achieve. And it's going to usually be a combination of all of the modes depending on what we're looking for.
Yes, and that's why you should take advantage of the waived consultation fee and register with Kate now. Okay, Kate, can you talk about what aftercare is like?
Sure. So aftercare is very different depending on what type of treatment we're doing. And like that slide I showed earlier, the type of downtime. So the most important thing for all of the aftercare is to remember you basically have a fresh wound. You have holes in your skin. So the most important thing for aftercare is keeping that skin clean and hydrated. So with a 3D miracle, you're going to walk out, a little sunburn looking, and you might need a little hypochlorous spray. I have a litany of things I can recommend for you. And I do sell post procedure kits and masks and things like that. But you're really just wanting to stay hydrated. So you're just going to keep it clean, use an occlusive ointment initially, like an Aquaphor or an Elastin Nectar, or I sell a Hydrinity, just to keep that moisture in the skin because you just don't want it to dry, especially right now in this weather, especially in Chicago. Um,
Especially.
for those that are having more aggressive treatments, especially with like laser coring, where you're going to have a wound that now is deep and oozy, maybe a little bit, you're going to have a little bit more care for that skin and that wound. And so I send you home with instructions for some saline soaks, vinegar soaks, to help that natural healing process. And sometimes there's some swelling also depending on the person and what area we're treating. I mean, if you look on the internet, some of these photos scare the crap out of people, but you could look like that if we did your whole face one way. So it's really, you can't judge what your aftercare is going to look like based on other people's, because we have to talk about what we're doing and what to expect for each area.
Okay, perfect. A couple of questions here. One very specific question. How many treatments would Christina need? Do you know, Chris?
Well, Christina, I don't know what we have to, well, based on your skin, so you have light skin and you have some freckling and some, you know, beautiful hair. you may only need one 3D miracle and you could have great results of that pigmentation. If there's something that's really deep or, you're young, but I always recommend a series of three ultra
Hmm.
clears. I
Hmm.
mean, sorry, 3D
3D
miracles.
musical. Yeah.
And the reason I recommend that series is because if we do that series once every 4 to 6 weeks, you're really getting all that cell turnover, and that's going to take care of a lot of issues in, someone in your young age range. But if you had like a big scar, I mean, I can see you in my head, but I can't remember. But if like you're like, Kate, I have this big scar, I have acne scars, I didn't look at your face closely. Well, that could take a more deeper.
Hmm.
But you can
Customized
usually do
treatment.
one and done with those too. But for the 3D Miracle, the really fast, easy, I recommend to start with at least three because you want to really get all the turnover.
Okay. Thank you. Another question here, if you use a more advanced mode, do you still need multiple treatments? You kind of started to address that.
No, so it really depends on what we're doing. So, when we are doing some of these advanced modes, we are getting almost to a surgical level of change. You're not gonna like people, you don't have surgery every year. So laser coring or some of those deeper, unless we're really working on like a tough scar or a really tough, like pigmented lesion you've had your entire life, you are not going to need multiple treatments with that modality, because it's going to get deep down and remodel. So there are people that want to just have glassy, perfect skin. They're going to want to do something super ablative once a year because they have the money in the world to spend. That's fine, but you really shouldn't need it more than once. Or like if it's a scar, once it's gone, it's gone, it's not coming back.
Mhm.
So it's just dependent on the treatment and what we're doing. And I think that's where this gets confusing, because like most lasers, it's like if you have a moxie, you do this many, if you have a BBL or an IPL. But this is so customizable. But people aren't doing CO2 treatments once a year or twice a year like you do maybe one or two in your life. So it just depends on what we're going after, how many you would need. But for most of those more aggressive ones, no, you're not doing it repeatedly.
Okay.
Unless you're like 75 and you want me to give you a non-surgical facelift, you might have to do it more than once. But it
Yeah.
just depends. Everyone heals differently. Everyone's cell turnover is differently. So but most likely no.
Okay. Last question here. Can you tell us a little bit about the cost and any patient financing options that you have?
Sure. So the 3D Miracle, which I know I've said like a million times, but that's more like your superficial ablation. So
Mhm.
normally that's $600 for the face. And we offer a series of three because that's what I recommend, which is 1,500. And then we do have patient financing options. And then we also have options at a discounted rate to add on the neck, just because that's a lot of surface area also. So it's not the same cost as the face to add on the neck, but it's still an add-on expense. And when you get to the more customizable treatments, because they are more involved and just lengthier time and more, it's a lot more going on.
Mhm.
So those can range from 1,200 to our most ablative, like laser coring with neck can be up to 3,500, which is still like an amazing compared to what most CO2s cost.
Okay. Thank you so much. I have
Mhm.
one more question here for you. What
Mhm.
surprised you the most about UltraClear once you got started using it?
How it is as versatile as they say. Um, the one thing that I think in aesthetics is, sale marketing people are really good at making their device sound like the best. And I always say to my patients, like, just because one product has really good, like I was like, I want a Moxie BBL because that's what's all over my feed and that's the best thing out there. And I would go out and seek those. Um, but I did a 3D Miracle and I had better results than my Moxie. And it was like way less downtime. My
Mhm.
Moxie, my face was on fire for 2 days. So I think it's just the marketing of the current things out there really leads us to believe they're the best. But when you actually look at the science and the technology, this is the best. And there's a reason we have next generations of antibiotics because the other ones weren't the greatest. So it is really different. And not everyone's going to have the most amazing results, but some people, their Botox doesn't work and we can't tell you why. So, there's still a patient factor in there, but really what blew me away with this device is not only how versatile it is, but like all the things I can do. It's not just because I want glowy skin. Um, you know, when I was talking to a lot of the dermatologists and that I was with, no one tried to sell me this device. It kind of landed in my lap because I had a meeting over the summer with an oculoplastic and we started talking about blephs because I'm convinced I needed one. She told me, no, you need a laser. And that led to a long thing that ended me at a conference with a bunch of plastic surgeons and dermatologists and oculoplastics. And they were talking and they weren't trying to sell me anything. They were educating me. And that was the one thing that I loved because there was no rep knocking on my door telling me this was great because they didn't need to because the science proved it. Um, there was a burn victim that was shared with me, and anyone that's on here that wants to see those pictures, I'm happy to share. But this person had, I think, 12 CO2 treatments. It was a full body burn. And a lot of us are nurses that, I interact with, it's my life. No, like that scarring, you limit movement. And this patient could not move his arms after 12 CO2s. That makes my heart hurt, the amount of pain that person must have gone through. But he had one treatment with this device and was able to lift his arms. So that's a real story. That's a real person. To me, it's about the patients and the patient experience and how I can make their lives better. So if that to somebody is getting rid of a sunspot that they've had and they can't get rid of with peels, if that's to get rid of a scar that just drives you crazy, I mean, it's about what it can do for the patient, and this allows me to pretty much do it all for anyone and be inclusive to anyone, any part of the body. And it's basically a really big smart computer, and they are constantly finding new ways to make it better, and they give you that information. It's not like a secret. It's not like, no, if you want to do this, you're going to give me X, Y, and Z for that module. Like, this company cares about people and about the health, and that was what led me to it. And it's really a medical device that is not going to be in the hands of every provider out there because it just can do so much. I mean, you can do surgery with this. You can actually do a bleph with this and cut with this laser. And I do not do surgery, but it is possible. So that's what is amazing about this and why, to be honest, when I first heard about it, I was like, oh, another laser, great. And then I really learned about it and realized like this is the future. This is what is going to change people's lives because in a society, we don't have downtime anymore. No one has 2 weeks to sit at home, even from I had plastic surgery and wanted to go back to work after 10 days, and I did. And that led me to many more problems because I wasn't healed because we just need to rush everything. So this leads you to be able to have really great things done and not be out of society for 10 days to 2 weeks. So that's what's the most amazing thing about it for me.
All right, perfect. Well, thank you so much, Kate. That wraps up our questions and our webinar. Please let us know if you are interested in booking with Kate. She is being extremely generous and giving us the 10% off, the free add-on treatment to the hands or an additional 3D miracle. And also, like we said, the extra surprise today was waiving the $100 consultation fee. So we hope to see you in the office soon. Thank you so much, Kate. Take care, everyone.
I